Which of the following is a live attenuated vaccine? Option A BCG, option B DPT, option C hepatitis B, option D rabies. The correct answer is option A BCG. Live attenuated vaccines contain weakened organism that stimulate strong immunity. Examples BCG, MMR, OPV, yellow fever comes under live attenuated vaccine. DPT and hepatitis B are inactivated or toxide recombinant. BCG is a live attenuated vaccine. Herd immunity is best achieved by option A passive immunity, option B active immunization, option C antibiotic therapy, option D immunoglobulin administration. The correct answer is option B active immunization. Herd immunity occurs when a large portion of population is immune via vaccination, reducing disease transmission. Passive immunity is a temporary, not contributing to herd protection. Passive immunity is a temporary, not contributing to herd protection. Passive immunity is transferred through option A vaccination, option B breast milk, option C herd immunity, option D natural infection. The correct answer is option B breast milk. Passive immunity is transfer of ready-made antibodies through placenta, breast milk, or immunoglobulin injections. Vaccination gives active immunity. Passive immunity is transfer of ready-made antibodies, placenta, breast milk, or immunoglobulin injections. Vaccination gives active immunity. Which type of vaccine usually requires booster doses? Option A live attenuated, option B killed or inactivated, option C recombinant, option D all of the above. The correct answer is option B killed or inactivated. Killed vaccines example salk polio, hepatitis A, rabies induce weaker immune responses, hence need boosters. Live vaccines provide long-term immunity. Killed vaccines salk polio, hepatitis A, rabies induce weaker immune responses, hence need boosters. Which of the following is not a killed vaccine? Option A typhoid, option B polio, option C influenza, option D yellow fever. The correct answer is option D yellow fever. Yellow fever is a live attenuated vaccine. The others are killed or inactivated vaccines. Yellow fever is a live attenuated vaccine. Other are killed or inactivated vaccine. Adjuvants are added to vaccines too. Option A increase antigen stability. Option B enhance immune response. Option C prevent contamination. Option D prolong shelf life. The correct answer is option B enhance immune response. Adjuvants are added to vaccines to enhance immune response. Adjuvants like aluminum salts boost the body's immune response to the vaccine. Adjuvants like aluminum salts boost the body's immune response to the vaccine. The cold chain in immunization refers to option A storage and transport of vaccines at recommended temperature. Option B administration of vaccines in winter. Option C keeping syringes sterile. Option D refrigeration of patient sample. The correct answer is option A storage and transport of vaccines at recommended temperatures. Vaccines must be stored between plus 2 degrees Celsius to plus 8 degrees Celsius to maintain potency. This is called the cold chain system. The cold chain in immunization refers to storage and transport of vaccines at recommended temperature. An example of toxoid vaccine is option A diphtheria, option B MMR, option C BCG, option D polio vaccine. Oral polio vaccine. The correct answer is option A diphtheria. Toxoid vaccines uses inactivated toxins, diphtheria, tetanus. They include immunity without causing disease. Toxoid vaccines use inactivated toxins, diphtheria, tetanus. They include immunity without causing disease. Which vaccine is given intradermally? Option A BCG, option B DPT, option C hepatitis B, option D OPV. The correct answer is option B, option A BCG. BCG is given intradermally on the left upper arm. DPT and hepatitis B given intramuscular, OPV oral. BCG given intradermally on the left upper arm. DPT and hepatitis given IM and OPV oral. Which vaccine is given orally? Option A polio, option B DPT, option C hepatitis B, option D tetanus. The correct answer is option A polio. Oral polio vaccine is given orally. Rotavirus and oral typhoid are also oral vaccines. OPV is given orally. Rotavirus and oral typhoid are also oral vaccines. The principle of vaccination is based on option A natural infection, option B immunoglobulin memory, option C passive immunity, option D genetic modification. The correct answer is option B immunological memory. Vaccines stimulate memory B and T cells which provide long lasting protection. The principle of vaccination is based on immunological memory. Vaccines stimulate memory B and T cells which provide long lasting protection. The following is not a contraindication for vaccination. Option A mild fever, option B severe allergic reaction, option C immunodeficiency for live vaccines, option D pregnancy for live vaccines. The correct answer is option A mild fever. Mild illness are not contraindication. Severe allergy, pregnancy and immunodeficiency are contraindicate for contraindication for vaccination. Which of the following is not a contraindication for vaccination? Option A mild fever. Which vaccine prevents tuberculosis? Option A BCG, option B MMR, option C OPV, option D typhoid. The correct answer is option A BCG. BCG protects against severe forms of childhood TB, especially miliary and meningitis TB. BCG protects against severe forms of childhood TB, especially miliary and meningitis TB. Tuberculosis. Which of the following is a conjugate vaccine? Option A HIP, Haemophilus influenza type B. Option B DPT. Option C OPV. Option D rabies. The correct answer is option A HIP. Conjugate vaccines attach polysaccharides to proteins for stronger immunity. Example HIP, pneumococcal, meningococcal. Conjugate vaccines attach polysaccharides to protein for stronger immunity. Example HIP, pneumococcal, meningococcal. Vaccination against smallpox was introduced by option A Louis Pasteur, option B Edward Jenner, option C Robert Koch, option D Jonas Salk. The correct answer is option B Edward Jenner. Edward Jenner used cowpox virus to immunize against smallpox. Louis Pasteur developed rabies vaccine. Vaccination against smallpox was introduced by Edward Jenner. Edward Jenner used cowpox virus to immunize against smallpox in 1796. Louis Pasteur developed rabies vaccine. Which vaccine prevents cervical cancer? The correct option A hepatitis B, option B HPV vaccine, option C MMR, option D yellow fever vaccine. The correct answer is option B HPV vaccine. HPV human papilloma virus vaccine prevents infection with the human papilloma virus which causes cervical cancer. HPV vaccine prevents infection with human papilloma virus which causes cervical cancer. HPV vaccine prevents cervical cancer. Which vaccine provides lifelong immunity usually after a single dose? The correct option A, oral polio vaccine. Option B, yellow fever vaccine. Option C, rabies vaccine. Option D, typhoid vaccine. The correct answer is option B, yellow fever vaccine. A single dose of yellow fever vaccine confers long-lasting immunity, often lifelong. Vaccine provides lifelong immunity usually after a single dose. Option B, yellow fever vaccine. A single dose of yellow fever vaccine confers. Which vaccine is given as nasal spray? Option A, influenza live attenuated. Option B, oral polio vaccine. Option C, BCG. Option D, hepatitis A. The correct answer is option A, influenza live attenuated. The live attenuated influenza vaccine is given intranasally. Influenza vaccine live attenuated vaccine is given intranasally. Which vaccine was eradicated globally in 1980? Option A, polio. Option B, measles. Option C, smallpox. Option D, yellow fever. The correct answer is option C, smallpox. Smallpox was eradicated worldwide in 1980 by vaccination campaigns. Smallpox was eradicated worldwide in 1980 by vaccination campaigns. Which type of immunity is produced by tetanus toxin? Option A, passive. Option B, active. Option C, both. Option D, natural. The correct answer is option B, active. Tetanus toxin stimulates the immune system to produce antibodies giving active immunity. Tetanus toxin stimulates the immune system to produce antibodies giving active immunity. Type of immunity is produced by tetanus toxin is active. At birth, which vaccine are given under Indians Universal Immunization Program? Option A, BCG, oral polio vaccine, hepatitis B. Option B, DPT, measles, hepatitis B. Option C, hip, typhoid, polio. Option D, rotavirus, pneumococcal. The correct answer is option A, BCG, OPV, hepatitis B. At birth, BCG, left arm, intradermal, OPV, hepatitis B, IM, given within 24 hours. The first dose of DPT is given at option A, birth. Option B, 6 weeks. Option C, 9 months. Option D, 12 months. The correct answer is option B, at 6 weeks. Primary immunization of DPT is given at 6, then 10 weeks and 14 weeks. First dose of DPT is given at 6 weeks. At 6 weeks. Measles vaccine first dose is given at option A, at birth. Option B, at 6 weeks. Option C, at 9 months. Option D, at 12 months. The correct answer is option C, 9 months. In India, measles containing vaccine is given at 9 months, followed by MMR 2 at 16 to 24 months. Measles vaccine first dose is given at 9 months. Pentavalent vaccine provides protection against option A, diphtheria, pertussis, tetanus, hepatitis B, hip. Option B, diphtheria, polio, measles, mumps, rubella. Option C, hepatitis A, hepatitis B, typhoid, hip, measles. Option D, diphtheria, tetanus, rabies, hip, polio. The correct answer is option A, diphtheria, pertussis, tetanus, hepatitis B, hip. Pentavalent combines 5 antigens into one injection, reducing risks. Rotavirus vaccine is administered by option A oral route, option B subcutaneous route, option C IM intramuscular, option D intradermal. The correct answer is option A oral route. Rotavirus is administered by oral route. Rotavirus is given orally to prevent diarrheal death in infant. Rotavirus is given orally to prevent diarrheal deaths in infant. Inactivated polio vaccine is given by option A oral, option B intradermal, option C intramuscular, option D subcutaneous. The correct answer is option C intramuscular. Inactivated polio vaccine is an inactivated vaccine given intramuscularly, usually in the anterior lateral thigh. Inactivated polio vaccine is given by intramuscular is an inactivated vaccine given IM usually in anterior lateral thigh. The correct schedule of vitamin A supplementation in India is option A at birth, then every 6 months up to 5 years. Option B at 9 months with measles, then every 6 months up to 5 years. Option C at 1 year only. Option D only if the child is malnourished. Option B at 9 months with measles, then every 6 months up to 5 years. Vitamin A prevents blindness. First dose 1 lakh international units at 9 months, then 2 lakh international units every 6 months till age 5. Vitamin A, which vaccine is given at 16 to 24 months under Universal Immunization Program? Option A MMR or measles 2. Option B Japanese encephalitis vaccine. Option C DPT booster 1 plus oral polio vaccine booster. Option D all the above. The correct answer is option D all the above. At 16 to 24 months DPT booster 1, OPV booster, MMR or measles 2, Japanese encephalitis given in endemic areas. DPT booster 2 is given at option A 16 to 24 months, option B 5 years, option C 10 years, option D 15 years. The correct answer is option B at 5 years. Second DPT booster is given at 5 years of age. Second DPT booster is given at 5 years of age. DPT booster 2 is given at 5 years. Which vaccine is recommended for adolescents at 10 and 16 years? Option A DPT, option B hepatitis B, option C measles, option D HPV. The correct answer is option A DPT. Tetanus plus diphtheria booster at 10 years and 16 years given as per UIP. Tetanus plus diphtheria booster at 10 years and 16 years recommended as per UIP. Which of the following vaccine is given subcutaneously in India? Option A measles or MMR, option B Japanese encephalitis, option C yellow fever, option D all of the above. The correct answer is option D all of the above. MMR, Japanese encephalitis and yellow fever are given by subcutaneous injection. Following vaccines is given subcutaneously in India. Option D all of the above. Measles, Japanese encephalitis, yellow fever. Which is the correct route for hepatitis B vaccine? Option A oral, option B intramuscular, option C intradermal, option D subcutaneous. The correct answer is option B intramuscular. Hepatitis B vaccine is given IM in thigh for infants or delta for older children adults. Correct route of hepatitis B vaccine option B intramuscular. Thigh for infants, and deltoid muscle for older children or adults. What is the minimum interval between two doses of DPT vaccine? Option A 1 week, option B 2 weeks, option C 4 weeks, option D 6 weeks. The correct answer is option C 4 weeks. Minimum interval between DPT doses is 4 weeks, 1 month. Minimum interval between two doses of DPT vaccine is 4 weeks, that is 1 month. Which of the following is not included in India's universal immunization program? Option A BCG, option B hepatitis B, option C typhoid, option D pentavalent. The correct answer is option C typhoid. Typhoid vaccine is not a part of a routine universal immunization program, though some states added it. Typhoid vaccine is not a part of routine UIP, universal immunization program. Which vaccine protects against Japanese encephalitis? Option A live attenuated SA 14 2 strain. Option B inactivated killed vaccine. Option C recombinant vaccine. Option D both A and B. The correct answer is option D both A and B. Japanese encephalitis vaccines available in both live and killed forms is commonly used in India. Japanese encephalitis vaccines are available in both live and killed forms. Live is commonly used in India. In India, hepatitis B birth dose should be given within option A 12 hours of birth, option B within 24 hours of birth, option C within 48 hours of birth, option D 7 days of birth. The correct answer is option B 24 hours of birth. Hepatitis B birth dose prevents perinatal transmission should be given within 24 hours. Hepatitis birth which of the following vaccine is not given at 9 months age? Option A measles, option B Japanese encephalitis, option C vitamin A, option D DPT. The correct answer is option D DPT. DPT is given at 6, 10, 14 weeks and boosters at 16 to 24 months and 5 years, not at 9 months. DPT is given at 6, 10, 14 weeks. Which of the following is given at a 6th week, 10th week and 14th at a 14th weeks? Option A OPV, DPT, hepatitis B, hip, rotavirus, inactivated polio vaccine. Option B BCG, MMR, typhoid. Option C vitamin A, Japanese encephalitis and tetanus toxoid. Option D smallpox, yellow fever. The correct answer is option A OPV, DPT, hepatitis B, hip, rotavirus, inactivated polio vaccine. Pneumococcal conjugate vaccine is given at option A at 6 weeks, 14, boosted at 9 months. Option B 6 weeks, 14 weeks, boosted at 9 months or 15 months. Option C at birth, 6 months, at 9 months. Option D 5 years only. The correct answer is option B at 6 weeks, 14 weeks, boosted at 9 months or 15 months. Pneumococcal conjugated vaccine is included in UIP. Phased introduction. Each of the following vaccine is stored in the freezer compartment, that is minus 50 degree Celsius to 25 degree Celsius. Option A oral polio vaccine, option B bacillus BCG, option C DPT, option D hepatitis B. The correct answer is option A oral polio vaccine. Oral polio vaccine is highly heat sensitive, stored in freezer. DPT and hepatitis D are damaged by freezing. Stored at plus 2 degrees Celsius to plus 8 degrees Celsius. Which vaccine is used in pulse polio immunization program? Option A, inactivated polio vaccine. Option B, OPV. Option C, pentavalent. Option D, DPT. The correct answer is option B, OPV. Pulse polio uses oral polio vaccine to immunize children below 5 years during national immunization tests. Which of the following is a killed polio vaccine? Option A, OPV. Option B, IPV, inactivated polio vaccine. Option C, both. Option D, none. The correct answer is option B, inactivated polio vaccine. Oral polio vaccine is a live attenuated. Inactivated polio vaccine is a inactivated vaccine. OPV is a live attenuated. IPV is a inactivated vaccine. BCG vaccine should be given at which site in infant? Option A, right thigh. Option B, left upper arm. Option C, right deltoid. Option D, buttock. The correct answer is option B, left upper arm. BCG vaccine should be given at left upper arm. BCG is given intradermally over the left upper arm. BCG is given intradermally over the left upper arm. Which of the following vaccines leaves a scar? Option A, DPT. Option B, oral polio vaccine. Option C, BCG. Option D, MMR. The correct answer is option C, BCG. BCG produces local ulcer, leads to heals, leaves permanent scar used to confirm vaccination. BCG produces local ulcer, after heals, leaves a permanent scar used to confirm vaccination. BCG vaccination leaves a permanent scar. Which is the correct schedule for tetanus immunization in pregnant women? Option A, 2 doses of TT at least 4 weeks apart. Option B, 1 dose of TT only. Option C, only if wounded. Option D, booster every 10 years only. The correct answer is option A, 2 doses of TT at least 4 weeks apart. Pregnant women need 2 doses of TT 4 weeks apart if previously unvaccinated. Rabies vaccine can be given by which route? Option A, intramuscular. Option B, intradermal. Option C, both. Option D, subcutaneous. The correct answer is option C, both. Rabies vaccine can be given IM or intradermal according to Thai Red Cross schedule. Rabies vaccine can be given IM or intradermal. Which vaccine prevents mumps? Option A, DPT. Option B, MMR. Option C, hepatitis A. Option D, rotavirus. The correct answer is option B, MMR. Which vaccine prevents mumps? Option B, MMR. MMR, measles, mumps, rubella. MMR stands on measles, mumps, rubella. Influenza vaccine should be repeated. Option A, every 3 months. Option B, every year. Option C, every 5 years. Option D, once in lifetime. The correct answer is option B, every year. Influenza viruses mutate, antigenic drift, so annual flu vaccination is recommended. Influenza vaccine should be repeated every year. Influenza viruses mutate, antigenic drift, So annual flu vaccination is recommended. Which of the following is a recombinant vaccine? Option A hepatitis B, option B oral polio vaccine, option C DPT, option D BCG. The correct answer is option A hepatitis B. Hepatitis B vaccine is prepared using recombinant DNA technology. Hepatitis B is a recombinant vaccine. Hepatitis B vaccine is prepared using recombinant DNA technology. Which vaccine is given to prevent cervical cancer? Option A hepatitis A, option B HPV vaccine, option C hepatitis B, option D MMR. The correct answer is option B HPV vaccine. HPV vaccine prevents infection with HPV strains causing cervical cancer, mainly types 16 and 18. HPV vaccine prevents infection with HPV strains causing cervical cancer, mainly type 16 and 18. COVID-19 vaccines like Covaxin are based on which technology? Option A live attenuated virus, option B inactivated virus, option C DNA vaccine, option D subunity vaccine. The correct answer is option B inactivated virus. Covaxin inactivated SARS-CoV-2 vaccine, Covishield adenoviral vector vaccine. Covaxin inactivated SARS-CoV-2 vaccine, Covishield is adenoviral vector vaccine. Measles vaccine protects against which complication most effectively? Option A diarrhea, option B pneumonia, option C blindness, option D subacute sclerosing panencephalitis. The correct answer is option D SSPA. Subacute sclerosing panencephalitis. Vaccination prevent measles and its late complication SSPA, a fatal neurological disease. Vaccination prevent measles and its late complication SSPA. Which vaccine is given during outbreaks to control meningitis epidemics? Option A HIP, option B meningococcal vaccine, option C pneumococcal vaccine, option D influenza vaccine. The correct answer is option B meningococcal vaccine. Meningococcal conjugate vaccine is used in epidemic situation, especially meningitis belt in Africa. Meningococcal vaccine is given during outbreak to control meningitis epidemic. Which of the following is a killed vaccine? Option A rabies, option B hepatitis B, option C BCG, option D MMR. The correct answer is option A rabies. Rabies cell culture vaccines are inactivated. BCG and MMR live. Hepatitis B is recombinant. Rabies cell culture vaccines are inactivated. BCG and MMR live. Hepatitis B is recombinant. Yellow fever vaccine is recommended for travelers to endemic countries. It is given as option A single subcutaneous dose, option B two intramuscular doses, option C oral suspension, option D intradermal schedule. The correct answer is option A single subcutaneous dose. A single subcutaneous injection protects for life, required for travel to Africa or South America. A single subcutaneous injection protects for life, required for travel to Africa or South. Which vaccine is contraindicated in HIV infected children? Option A oral polio vaccine, option B BCG, option C MMR, option D both A and B. The correct answer is option D A and B. Live vaccines OPV BCG are contraindicated in immunocompromised children. IPV is used instead of OPV. Live vaccines OPV and BCG are contraindicated in immunocompromised children. IPV is used instead of oral polio vaccine. The vaccine contraindicated in HIV, which is the only vaccine that provides protection against parasitic disease. Option A BCG, option B malaria vaccine, option C rabies, option D typhoid. The correct answer is option B malaria vaccine. RTS is the vaccine is the world first malaria vaccine, protects against Plasmodium falciparum. The only vaccine provides protection against parasitic diseases, malaria vaccine, RTS, S-type. Which vaccine is contraindicated during pregnancy? Option A, TT. Option B, TT or TD. Option B, influenza. Option C, MMR. Option D, hepatitis B. The correct answer is option C, MMR. Live vaccines, MMR, varicella, yellow fever are contraindicated in pregnancy. Live vaccines, MMR, varicella, yellow fever are contraindicated in pregnancy. Which vaccine prevent shingles? Option A, varicella vaccine. Option B, zoster vaccine. Option C, MMR. Option D, both A and B. The correct answer is option D, both A and B. Varicella vaccine prevent chickenpox. Zoster vaccine prevent shingles in older adults. Varicella vaccine prevent chickenpox. Zoster vaccine prevent shingles in older adults. In rabies, post-exposure prophylaxis, rabies immunoglobulin is option A, given only for category 1 exposure. Option B, given for category 2 exposure. Option C, given for category 3 exposure. Option D, not required if vaccinated. The correct answer is option C, given for category 3 exposure. Category 3, severe bites, scratches, licks on mucosa, RIG plus vaccine required. Which of the following is an example of adverse event following immunization? Option A, anaphylaxis after DPT. Option B, fever after measles vaccine. Option C, injection site abscess. Option D, all of the above. The correct answer is option D, all of the above. Adverse event following immunization includes minor fever, pain, and serious abscess convulsions and severe anaphylaxis death events. Which vaccine is most commonly associated with high grade fever and febrile seizures? Option A, DPT, whole cell pertussis. Option B, hepatitis B. Option C, BCG. Option D, OPV. The correct answer is option A, DPT, whole cell pertussis. Whole, whole cell pertussis component causes fever, irritability, sometimes febrile seizures. Acellular is safe. Vaccine associated paralytic poliomyelitis is complication of option A, OPV. Option B, IPV. Option C, both. Option D, none. The correct answer is option A, OPV. OPV is live attenuated. Rarely it reverses to virulence, causes vaccine associated paralytic poliomyelitis. IPV never causes VAPP. OPV is live attenuated. Which vaccine may cause a local ulcer that heals with scarring? Option A, BCG. Option B, hepatitis B. Option C, DPT. Option D, MMR. The correct answer is option A, BCG. BCG causes local ulcer, heals and leaves scar. BCG vaccine causes local ulcer that heals with scarring. Hypotonic hyporesponsive episode is an adverse reaction seen after. Option A DPT, option B BCG, option C hepatitis B, option D measles. The correct answer is option A DPT. Hypotonic hyporesponsive episode is sudden collapse with pallor, cyanosis seen in infants after pertussis containing vaccines. Hypotonic hyperresponsive. Which of the following vaccines should not be frozen? Option A DPT, option B hepatitis B, option C pentavalent, option D all the above. The correct answer is option D all the above. Freeze sensitive vaccines lose potency when frozen. Like DPT, hepatitis B, pentavalent vaccine. Only OPV can be frozen. Only OPV can be frozen. DPT, hepatitis B, pentavalent should not freeze. Which vaccine vial monitor is used to check heat exposure of vaccines? Option A OPV, option B DPT, option C hepatitis B, option D all vaccines. The correct answer is option A OPV. OPV is the most heat sensitive vaccine vial monitor is mandatory. Slowly darkening square shows cumulative heat exposure. OPV is the most heat sensitive vaccine. VVM is mandatory. Slowly darkening square shows cumulative. Which type of refrigerator is used at PHC level to store vaccines? Option A walk-in cooler. Option B ice lined refrigerator. Option C deep freezer. Option D domestic refrigerator. The correct answer is option B ice lined refrigerator. PHC use Iceland refrigerator to maintain 2 to 8 degrees Celsius. Domestic refrigerator are not recommended. PHC's use polio eradication was possible because option A humans are only reservoir. Option B effective vaccines are available. Option C easily diagnosis by stool testing. Option D all of the above. The correct answer is option D all of the above. Polio eradication is feasible since humans are the only reservoir. Stool diagnosis is simple and OPV or IPV are effective. Polio eradication was possible because humans are only reservoir. Effective vaccines are available. Which organization launched the expanded program on immunization in 1974? Option A UNICEF, option B WHO, option C Gavi, option D UNDP. The correct answer is option B WHO. WHO launched expanded program on immunization in 1974. India started UIP in 1985. WHO launched EPI in 1974. India started UIP in 1985. Global Alliance for Vaccines and Immunization was founded. Option A Global Alliance for Vaccines and Immunization was founded in option A 1974, option B 1985, option C in 2000, option D in 2010. The correct answer is option C in the year of 2000. Global Alliance for Vaccines and Immunization was created in 2000 to increase vaccine access in low income countries. Gavi was created in 2000 to increase vaccine access. Smallpox was eradicated in option A in 1967, option B in the year of 1977, option C 1980, option D 1995. The correct answer is option C 1980. WHO declared global eradication of smallpox in 1980. Last case in Somalia in the year of 1977. WHO declared global eradication of smallpox in 1980. Which country reported the last case of naturally occurring smallpox? Option A India, option B Somalia, option C Bangladesh, option D Pakistan. The correct answer is option B Somalia. Last natural case of smallpox reported in Somalia in the year of 1977. Country reported the last case of naturally occurring smallpox is Somalia country. India was declared polio free in option A 2005, option B in the year of 2010, option C 2014, option D 2019. The correct answer is option C 2014. Who declared India polio free in 2014 after last case in 2011? Who declared India polio free in 2014 after last case in 2011? Vaccine derived polioviruses are associated with option A inactivated polio vaccine, option B OPV, option C both, option D none. The correct answer is option B OPV. Rarely OPV virus mutates vaccine derived polio viruses outbreaks. Vaccine derived polio viruses are associated with oral polio vaccine. Which vaccine should be protected from light? Option A BCG, option B measles, option C vitamin A, option D all of the above. The correct answer is option D all of the above. Light sensitive vaccines lose potency. Example BCG, measles, rubella, vitamin A must be kept in dark vials. BCG, measles, vitamin A vaccines should be protected from light. Which of the following vaccines is heat stable? Option A HPV, option B hepatitis B, option C tetanus toxoid, option D measles. The correct answer is option C tetanus toxoid. Tetanus toxoid is relatively stable to heat. HPV and measles are very heat sensitive. Tetanus toxoid is relatively stable to heat. OPV and measles are very heat sensitive. Vaccine vial monitors indicates option A freezing of vaccines, option B heat exposure over time, option C bacterial contamination, option D volume of vaccine used. The correct answer is yeast exposure over time. Vaccine vial monitors show cumulative heat exposure, not freezing damage. Vaccine vial monitors indicates heat exposure over time, not freezing damage. Contraindication for DPT vaccine is option A high fever after first dose, option B severe allergy, option C encephalopathy after pertussis vaccine, option D all of the above. The correct answer is option D all of the above. Absolute contraindication encephalopathy after previous pertussis vaccine. Relative is severe allergy, high fever. Absolute contraindication encephalopathy after previous pertussis vaccine. Relative contraindication is severe allergy, high fever. Which is the most common cause of vaccine failure? Option A improper storage, cold chain failure. Option B incorrect dose. Option C genetic resistance in host. Option D use of wrong syringe. The correct answer is option A improper storage, cold chain failure. Heat and freeze damage due to poor cold chain is the most common cause of vaccine failure. Most common cause of vaccine failure is improper storage, cold chain failure. Which of the following is a conjugate vaccine? Option A, Haemophilus influenza type B. Option B, BCG. Option C, oral polio vaccine. Option D, MMR. The correct answer is option A, Haemophilus influenza type B. HEAT is a polysaccharide conjugated with a protein carrier. Improves immunogenicity in infants. The following is a conjugate vaccine. Option A, HIB, is a polysaccharide conjugated with a protein carrier. Improves immunogenicity in infant. Pentavalent vaccine protects against. Option A, DPT plus hepatitis B plus HIB. Option B, DPT plus polio plus hepatitis B. Option C, DPT plus hepatitis B plus rotavirus. Option D, DPT plus measles plus HIB. The correct answer is option A, DPT plus hepatitis B plus HIB. Pentavalent vaccine give protection for 5 diseases in one vaccine. That is DPT plus hepatitis B plus HIB. Rotavirus vaccine is given by which route? Option A, intramuscular. Option B, oral. Option C, subcutaneous. Option D, intradermal. The correct answer is option B, oral. Rotavirus vaccine is live oral vaccine, prevents severe diarrhea in infants. Rotavirus vaccine is given by oral route. Rotavirus vaccine is given by oral route. Human papillomavirus vaccine prevents option A, cervical cancer. Option B, breast cancer. Option C, ovarian cancer. Option D, liver cancer. The correct answer is option A, cervical cancer. HPV vaccine, bivalent, quadrivalent, non-valent, prevents cervical cancer and genital warts. HPV vaccine prevents cervical cancer. Japanese encephalitis vaccine is included in India UIP in which districts? Option A, all districts. Option B, only endemic districts. Option C, urban areas. Option D, none. The correct answer is option B, only endemic districts. Japanese encephalitis vaccine is given in endemic districts of India, mainly eastern states. Japanese encephalitis vaccine is included in India's UIP in only endemic districts. Which vaccine is recommended for travelers to yellow fever endemic countries? Option A, yellow fever vaccine. Option B, hepatitis B vaccine. Option C, cholera vaccine. Option D, typhoid vaccine. The correct answer is option A, yellow fever vaccine. The vaccine recommended for travelers to yellow fever endemic countries is option A, yellow fever vaccine. Yellow fever vaccination certificate is mandatory for travelers to sub-Saharan Africa and South Africa. Yellow fever vaccination certificate is mandatory for travel to sub-Saharan Africa or South America. Rabies vaccine is given post exposure along with rabies vaccine is given post exposure along with option A, tetanus toxin. Option B, rabies immunoglobulin. Option C, BCG. Option D, OPV. The correct answer is option B, rabies immunoglobulin. For category 3 bites, both rabies vaccine plus RAG are given. Rabies vaccine is given post exposure along with rabies immunoglobulin. Which vaccine is contraindicated in pregnancy? Option A, rubella. Option B, tetanus toxin. Option C, influenza. Option D, hepatitis B. The correct answer is option A, rubella. Live vaccines, MMR, varicella, yellow fever contraindicated in pregnancy. TT is given routinely. Rubella is contraindicated in pregnancy. Herd immunity is best achieved by which vaccine? Option A, oral polio vaccine. Option B, inactivated polio vaccine. Option C, tetanus. Option D, rabies. The correct answer is option A, OPV. Oral polio vaccine spreads to close contacts. Second spread is strong herd immunity. Herd immunity is best achieved by oral polio vaccine. Oral polio vaccine spreads to close contacts. Secondary spread, strong herd immunity. Which vaccine is recommended for healthcare workers against accidental needle stick injury? Option A, hepatitis B. Option B, MMR. Option C, varicella. Option D, cholera. The correct answer is option A, hepatitis B. Hepatitis B vaccine protects healthcare workers at risk of bloodborne exposure. Which vaccine is recommended for healthcare workers against accidental needle stick injuries? The correct answer is option A, hepatitis D. Pneumococcal conjugate vaccine prevents option A, pneumonia and meningitis. Option B, tuberculosis. Option C, hepatitis. Option D, measles. The correct answer is option A, pneumonia and meningitis. Pneumococcal conjugate vaccine protects infants and elderly from pneumonia, otitis media, meningitis causing by streptococcus pneumoniae. Meningococcal conjugate vaccine protects infants and elderly from pneumonia, otitis media, meningitis causing streptococcus pneumoniae. Which is the birth dose vaccine given within 24 hours of the birth? Option A, BCG plus OPV plus hepatitis B. Option B, DPT plus hepatitis B. Option C, measles plus BCG. Option D, BCG plus MMR. The correct answer is option A, BCG plus OPV plus hepatitis B. Birth doses include BCG, OPV, hepatitis B. Birth dose include BCG, OPV, hepatitis B. In immunocompromised children, which vaccine is contraindicated? Option A, live attenuated vaccines, example MMR, OPV. Option B, inactivated vaccines. Option C, toxoid vaccines. Option D, recombinant vaccines. The correct answer is option A, live attenuated vaccines. Live vaccines can cause diseases in immunocompromised children. Live attenuated vaccines causes disease in immunocompromised children. It should be contraindicated. Which of the following is a recombinant vaccine? Option A, hepatitis B. Option B, BCG. Option C, DPT. Option D, OPV. The correct answer is option A, hepatitis B. Hepatitis B surface antigen is produced using recombinant DNA technology. Hepatitis B surface antigen is produced using recombinant DNA technology. Typhoid conjugate vaccine is recommended for children starting from option A, 6 months. Option B, 9 months. Option C, in 1 year. Option D, 2 years. The correct answer is option C, at 1 year. Typhoid conjugate vaccine can be given from 1 year of age, better protection than older polysaccharide vaccines. Typhoid conjugate vaccine given from 1 year of age, better protection than older polysaccharide vaccines. Which vaccine is given at 9 months in India's UIP? Option A, measles rubella. Option B, DPT booster. Option C, polio booster. Option D, hepatitis A. The correct answer is option A, measles rubella. Measles first dose is given at 9 completed months. Measles rubella is given at 9 completed months. Measles rubella is given at 9 months in India's UIP. Which vaccine is known as triple antigen? Option A DPT, option B MMR, option C pentavalent, option D DT. The correct answer is option A DPT. Diphtheria, pertussis, tetanus is called triple antigen vaccine. DPT vaccine is called triple antigen vaccine. Diphtheria, pertussis, tetanus. Cold chain should maintain vaccine set. Option A 0 degree Celsius to plus 4 degree Celsius. Option B plus 2 degree Celsius to plus 8 degree Celsius. Option C minus 20 degree Celsius to 0 degree Celsius. Option D plus degree Celsius to plus 20 degree Celsius. The correct answer is option B plus 2 degree Celsius to plus 8 degree Celsius. Ideal temperature for vaccine storage is 2 to 8 degrees Celsius except OPV can be frozen. Cold chain should maintain vaccines at plus 2 degrees Celsius to plus 8 degrees Celsius. Which vaccine was the first to be eradicated globally? Option A smallpox, option B polio, option C measles, option D rinderpest. Option A smallpox. Smallpox was the first disease eradicated in 1980. Rinderpest, second eradicated in 2011. The ultimate goal of immunization is option A to provide individual protection only, option B reduce hospital admissions, option C achieve herd immunity and disease eradication, option D improve nutrition. The correct answer is option C achieve herd immunity and disease eradication. Immunization protects individuals plus reduces transmission and gives herd immunity that eradicates smallpox and polio.